Hi,
Dr. Megha.
hi
How are
Jessica. How are
you?
you? I'm good. And you?
I am good. I think I'm so excited that I'm forgetting my words here. It's our first time going
Thank you
live.
for having me.
Say that again?
Thank you for having me over, giving me the opportunity to spread some awareness.
Oh no, of course. I'm just excited that you'll be able to share some goodness with us because I think it's our first live, and I really wanted it to be
Thank you.
around Breast Cancer Awareness Month. And because it's such an important topic, like it's a growing disease that is just taking over the youth. And we just really want to start addressing that. How do we start preventing a lot of these issues that's causing breast cancer, right? Because we're missing out on the symptoms, and we really want to make sure that we can have these conversations locally. We don't always want to look to global markets for insights because there's always differences in that. So on that note, I have some questions for you. I have my little cue cards so I can make sure we get through. And I'll start with the basic question. The first
All right.
question is, how does an individual actually get breast cancer?
Well, Jessica, there are a lot of risk factors that an individual can develop breast cancer. Many of them are unavoidable. By unavoidable, I mean is age. As the age increases, you get the chances for developing the breast cancer is more. You cannot modify that. Your family history, that you cannot modify. What is your race? These are the things that cannot be modified. So one is the age. With increasing age, it becomes more common. Second is female sex, again, non-modifiable. Females are affected more. It is, in fact, 100 times more common in women as compared to men. Other factors, race. Now, here, because we are talking about breast cancer, specifically in people of color, I want to talk about on this. Historically, the white race was believed to be developing breast cancer more commonly. The incidence in them was higher. But over the past few years, the incidence in them has pretty much stayed the same, but the incidence in people of color has continuously risen to the extent that now they are pretty much at the same level. Other risk factors can be sorry, you wanted to say something?
No, I said that's interesting. That's interesting to actually know that. So you're saying that people of color, we have lower risk, but when we do actually capture that disease, it's just more severe.
I am trying to say that initially it was believed that people of color have lower risk, but now it is not the case. Also, when people of color develop it, definitely the disease is more aggressive. The kind of disease that affects people of color, that is more resistant to treatment, that is more likely to come back as a relapse. So these are the things. So initially, thinking that it is not affecting people of color, the white are the ones who need to be investigated, the whites are the ones who need to be screened, that is not the case anymore. Now, the other risk factors are the very important risk factors which are modifiable are how many kids you have. Nulliparity, so not having any kids, increases your risk towards breast cancer. Or having your first kid at a later age, later than 35 years, increasing your risk to develop the cancer. Then not breastfeeding. Breastfeeding is one of the most important factor that reduces the risk. The longer you breastfeed the kid, the lesser the risk is. So if you're not breastfeeding, that increases the risk. Other factors are, another very important factor is genetics. So if there are certain genes, there are certain gene mutations that can cause breast cancer. I'm sure everybody has heard about BRCA1, BRCA2, but there are multiple genes, P10, P53, HER2/neu. There are many different genes in their mutations can also cause breast cancer. So if somebody has in the family running these genetic mutations, that individual is more likely to develop breast cancer at an earlier age.
Wow. Okay. So you
And
actually have a question that was sent. I want to kind of address this because this is a common thing in our community, right? So basically asking about going to the doctor. Is it that because we go to the doctor less, we are not likely to identify the symptoms earlier on?
That is one of the reasons. Either people are not going to the doctor enough, or they are not getting themselves investigated enough. Or the resources are not available. Be it the doctor is not available where they can screen the mammograms, the ultrasounds, the MRI, that is not available. Insurance approval doesn't come, so they don't want to pay it from their own pocket. In the end, it is everybody buys food, everybody goes to watch movies. But when it comes to your health, people tend to, that is where they want to save money. So that is also one of the factors that is really important. Also, the misconception that we are fine, nothing can ever happen to us. This belief it is a good. It is, don't get me wrong.
I'm that person. I am that person.
It is a very positive trait, yes, but that positive has to stay here. It doesn't have to go towards, ignorance. That is what I'm trying to say. So yes.
Fair. All right, no, that's a good point. I'll definitely say I'm that person that I don't go to the doctor as often as I should. Actually, moving to the UAE, I go to the doctor a lot more because I'm just very conscious. I don't have my family here, so I'm like, let me get my checkups. So I am that person you're speaking about. Hi, I live in my truth.
I'm good. I'm happy UAE has changed you for the better.
All right, so I'm going to read this particular one because it's a stat from cancer.org. So it says less than 5% of breast cancer patients are under 40. However, in the most common type of cancer, young adults between 15 and 39 are more likely to catch breast cancer. So we're saying the younger you are, it looks like we're more likely to catch breast cancer.
See,
what do you think about that statement?
The incidence definitely increases with age, for sure. So a person who's 75 is more likely to have this cancer as compared to a person who's 30. But if we take into account all the genetic mutations, these genetic mutations make an individual develop a cancer or a condition earlier to what an average, average person would. So if an average lifetime risk for an individual in a general population is 15, for a person who has any kind of genetic mutations related to breast cancer, it increases to more than 20, and which is saying a lot, 20%. That means 1 in 5. So these are the individuals who we can pick from a careful history. A person will, of course, know himself if he is or she is in that genetic, if there is any history of familial cancers. And it is not just breast cancer. It includes the familial risk increases with pancreatic cancers, breast cancer, ovarian cancer. There are certain genetic conditions like Leigh-Fermoni syndromes. So all these are related to, there's a bunch of diseases related to these set of mutations, which we just talked about before. And if the family, if the individual is carrier of one of these, they definitely can get. So yeah, people can get this cancer even before 40.
Okay, so then then I guess let's break it out in twos, right? So what if I don't know of anyone in my family who has cancer or who had cancer. So how often should someone like me get tested, or when should I start getting tested? And the opposite for someone who has family members.
Very interesting question, Jessica, because there is such a simple solution available for it. And these days you can find everything on the net, honestly. As a doctor, I shouldn't be saying this, but I am saying it. So there is a very simple risk assessment tool that is available. You just have to type breast risk assessment tool. And it asks you very simple questions that every individual can answer. What is your age? How many kids have you had? When did you start? When did you first have your menstruation? So when did you start your periods? At what age? This is also an important risk factor. early menarche or having a first period at an earlier age also predisposes you towards developing this. So there are certain questions, what is your race? And you just have to put in these data and it immediately, instantaneously calculates what is your risk. Now, the average risk for the population that we are talking about is 15%. So if you're anywhere 15% or less, you fall into average risk. Then there is a moderate risk, which is 15 to 20%, and a high risk, which is more than 20%. All these we can simply calculate sitting at home at the convenience of, at our own convenience. It is called GAIL model, GAIL, GAIL, and it is very simple to use. Now, once you have determined the risk, this determines when you should start the screening and how frequently you should have the screening. Say, for example, like you said, you do not have any history, everything falls into place, and we are assuming that you are someone with average risk. Then you need to start your less than 40, probably not needed. More than 40, up to 49, discuss. We can, again, what kind of a person you are. Do you really want to know everything what's going on with your body? Do you want to stress yourself out? In the end, any screening procedure, we always have this, we have to balance it out. They do have a risk of overdiagnosing things. So do you really want to go into that or not, this and that? So you can start screening after 40, but definitely after 50 is something that you should start. Now, how frequently and how? Breast manual exam is an easy tool, important tool, but this does not eliminate the need for a mammogram. With a finger, even if the doctor is doing it, even if the person is doing it to herself, it cannot equate what the mammogram can find. So definitely the screening method is mammogram, which you can do 1 yearly, 2 yearly after you're 50, or earlier, depending upon what you have decided discussing with your doctor, how soon you want to begin screening after 40. Okay. Are you with me so far?
No, I'm here. I'm just absorbing it. I'm taking it all in.
All right. No, so it's not all very confusing, and still, all right, you are able to follow.
Yes. Can you guys follow in the chat? Was this clear? Just heart us a little bit so we know that you guys are still with us. So one of the things that I was thinking about as I was going through, like, kind of gathering research data or information on this topic, is that when we start thinking about breast cancer, we normally relate it to women. So there's more conversations and discussions happening around women and breast cancer, but there's not enough about men. So I guess a naive question here is, can men get breast cancer?
Yes, they can. And I will answer this question, but let me again go back to the previous question. I'm yet not done with the previous question.
Oh, please continue then. Listen, I'll take it.
So we have talked only about the people with moderate or the average risk. Now, what happens if somebody is in the moderate risk? That means probably a family member has breast cancer. No, and they do not know about the mutation. What is the mutation status? These people still fall in the moderate risk. And again, the age at which the family member developed the cancer is also important. Was it after 60 years, after 65 years? It is less likely to be a genetic mutation-related cancer. Did the family member, the first-degree relative, second-degree relative, develop the cancer at a lesser stage? Say 35, say 40. These cancers are more likely to be genetic mutation related. So then the chances are that you might be a carrier of this genetic mutation. So these all change your risk. Similarly, now, if you are in the high risk category, when the lifetime risk of you developing the cancer is more than 20%, then we cannot say that just sit at home till 40. You definitely need to come in before. If you have somebody in your family who has developed breast cancer, before 40 years of age. If you know somebody who has not just breast cancer, ovarian cancers, pancreatic cancer, we were discussing some of the genetic syndromes. If somebody has had radiation to the chest, which some of the leukemias, we give radiation to the chest in the early years, these all become high risk individuals that they need to start screening earlier, and definitely mammograms once a year, once every year, or once every 2 years, depending upon what is the result of the first mammogram, how dense are the breasts, and this all affect the frequency of screening.
Wow.
Now let me come to the second question. You were asking, are men exempt from this disease? Well, they are affected, not as frequently as women, but yes. So if the incidence in women is 1 in 8, the incidence in men would be 1 in 1,000. But still, that 1% is getting affected. Again, in men, the breast cancers are mostly because of these genetic mutations in the family. And if BRCA1 mutation is more related to breast cancer in women, BRCA2 mutation is more implicated in breast cancer in men. So definitely they need, if they fall into a high risk, which they will know by their family history, they definitely need to screen, they definitely need to check. If they see any changes in the breast texture, if there is any swelling, if there is any lump that they can visibly notice, if there is changing in the skin, changes in the skin, the texture of the skin over the breast. These are all the symptoms, not in men, not just in men, in women. These are the same symptoms. By the time they are visibly appearing, probably the cancer has been, into a more aggressive, more advanced stage.
Wow. Okay.
So definitely screening. We do not wait for these symptoms because there are no warning symptoms in the end. There can be, you see a lump, you see a swelling, but trust me, you do not want to wait till that time.
And I think that's kind of leading to my next question, is in identifying, besides doing, I guess, the breast test, on your own. And yes, we should go to a professional to kind of help us, get a more intense screening. But what are some other things that kind of drive, the symptoms of breast cancer? Like, is it stress related? Like, what are things that we should be considering as a factor?
See, honestly, like I said, many a times, most of the times, when the symptoms actually appear, it is late. So the best way to identify breast cancer is through screening. And screening means that you do not have any symptoms. You are just going for your regular check. That is the most important. Then other than that, the symptoms are the same. Swelling, redness, change in the texture of the skin, puckering of the skin, the nipples being inverted or being at different levels, not from always. So people may have nipples at different levels, but is there a recent change? Only if it is a recent change, then it is important. So these are some of the symptoms, yes.
Oh, that's
you should
good to know,
know.
because I didn't even know about the nipple changing. Like, all I knew as a novice in this conversation is the lump, the check for the lump on the breast. So these other things to look out for are critical, essentially, to ensure that we don't put ourselves in that position. So I did have another question regarding now post sorry, lose my train of thought. So I have a question around someone who does actually have breast cancer, or or family members who are dealing with someone who has breast cancer. What kind of treatment should they be thinking about? Because I know it's more than one, and I think we kind of geared towards one end of the spectrum. So curious to know from you, what are the different types of treatments out there?
Well, honestly, oncology, so the study of cancers, is one of the most advancing fields in medicine. Every day we have some new recent advances. So we cannot say that there is this, we just have one mode of treatment for a particular condition in cancer. One, the treatment is very much individualized, depending upon the stage of the disease, which is how bad, which area of the body it has spread? Is it limited to one breast? Has it spread to the other breast? Has it spread to the lymph nodes? Has it spread to the chest wall and other organs? So treatment depends upon the stage of the disease. Treatment depends upon the grade of the disease. So how bad the cancer cell looks. Some of the cancer cells are very well divided. They look just like the normal breast tissue, which is more common in people of at higher age. Then there are certain breast cancers in which the cells are very less differentiated, and which is one of the cancer that is more common in people of color, which is more aggressive. Then the treatment depends upon the patient's wishes. The patient wishes do come into, if and the doctor needs to consider what is the general life expectancy of a person. If a woman at 85 develops a cancer and a woman of 35 develops the cancer, the treatment cannot be same in both of them. You have to consider the life expectancy of the individual before embarking
So it's
on
not
to
apples
some.
to apples. It's very personalized to that individual and
It is
many
very, very
factors that relate
personalized.
to that.
Exactly. And then there is surgery. So the surgery again can be of multiple type. You can just remove a lobe of the breast. You can remove the complete breast. You can remove both the breasts. Depends upon the stage grade. Then there are hormone therapy. Many of the cancer of breast cancers are hormone responsive. So they have estrogen receptor, progesterone receptors. We just give them anti-estrogen, anti-progesterone, and we are keeping them at control. So these are simple hormone treatments. Then there is chemotherapy, radiotherapy. So if somebody has diagnosed with breast cancer, my advice would be do not lose hope. This is one field of medicine which is developing every single day, and the advances that are happening in this field are so exciting. Mind my word, in a medical, in a medical fraternity point of view, I'm saying exciting because you have more tools to support the people. You just cannot, to an individual who comes, you cannot say that, sorry, your disease is so advanced, we cannot treat you. Now, this is not the case. Probably this was the case 30 years ago, but now we have tools, we have means, and we have methods that any person, every person can lead a very normal life. So do not lose hope once you diagnose breast cancer.
So actually, that's part B of one of my questions that I have for you. So in the UAE specifically right now, do you think that we're there with the technology and the education around breast cancer to really help the community here?
In UAE or in everywhere rest of the world, women are very less represented. Okay, here, but I find it a little better than the rest of the world. We have pink campaigns, we have full-on October months. So you go at an airport. If you're standing in a queue and you're a woman, you're given a priority. You do not see this. So women here in UAE, I would say, are a bit more privileged. They're given a bit more, respect than I would say in the rest of the world. Having said that, still, yes, we are a long way to go. So we are not where we should be. There are certain resources, there are certain groups that I think you must have compiled. So there are certain groups where you can find support, breast friends, pink caravan, things like that. And then there are doctors. You go to a doctor if you have any question, any question. You just go to a doctor. You just go to a specialist. You put on your concerns. The doctor is there to answer them. Mm-hmm. So that is your first point of contact. So don't.
So let me
the basic idea: don't be hesitant to ask. That's it.
I think because so I'm gonna put myself in that person's shoes. Like even for me, I'm very nervous about going to doctors, especially out here, simply because I'm a Nigerian American, and I don't think I'm gonna go into the doctor and they're going to know how to treat me. That's just the fact. And I know it's probably something that stems from just a deeper conversation in itself. But the reality is, I don't necessarily always feel comfortable. I have to go through a rigorous process to identify a doctor I want to go to, then interview them in person, and to make sure they understand me, because they treat it, for the most part, I'm not speaking for everyone, but in general, they treat it like a one size fit all, and that's not the case, right? So on that note, like, how can we as women and men find the, like, how do we interview our doctors to find the right ones for us to address our needs? Like, what are the questions that we should be asking?
See, the questions you should be, one is, do not overcomplicate your life. It is this simple in the end. Wake up, get ready, and go to a doctor. And interestingly, in Dubai, it is not hard to find. We are one of the most densely populated city or country when it comes in terms of medical population. So here you can easily get an appointment. Wake up, you just have to make up your mind. I think the most difficult part is making up your mind. Getting there, and that is where the awareness comes into picture. We need to be aware, and then only we can, look for it. If we do not know there is something like breast cancer, or that it can actually affect us as well, why the hell would we care? We are going on our lives as it is. So the first thing is just go to a doctor and ask questions. Like I said, if you do not want to assess your risk on your own, although it is very simple, go to a doctor, let the doctor do the job for you. And then you know where you stand, how serious you should be about the screening, how soon, when, how much. There you get all your answers. Just visit the doctor.
So then, okay, so you say that, and sorry, I'm being maybe a little cynical here, but guys in the chat, let me know if you feel the same way, because yes, we can just go to a doctor, but it's like going to, I'm giving them my life. I'm telling you as a doctor, I'm giving you my life. I think I feel something, or I just want to make sure I'm okay. Yeah. So how do I know that they have my best? Besides knowing that they're a doctor and their job is to have your best interest in mind, how do you make sure that they do? Because the reality is, the UAE specifically is a melting pot, right, of various countries coming into one. There's different culture sets here. So how do I know if I go outside of my comfort zone, because the professional that's next door to me, the doctor that's next door to me, is not of a Nigerian or American descent, which is my background. How do I know that they're going to work best for me? So I think I just really want to get to the bottom of, how should we evaluate beyond just going to the doctor? How do we evaluate the professionals that is going to serve us well? Like, are there any key questions we should be looking out, or red flags we should look out for?
See, honestly, being in the medical profession, I would like to think that every doctor has the patient's best interest in their heart.
Mm-hmm.
If somebody, really, why? And this country is very much blessed in this regard, that most of us are expats here, right? So there is no discrimination. I would not say that I will not see a person from a certain country, from a certain race, from a certain background. No. In this country, honestly, it comes down to insurance. Where is my insurance being covered? And that is it. That is it. But yeah, there are specialist doctors. There are one, you can go to a gynecologist. Then there are specific breast surgeons. There's geneticists. So if you think there is a positive family history of cancer in your family, then probably the person you would want to visit is a geneticist. But again, the first point of contact is either your GP, general physician, or your gynecologist. Once you have the screening in place, depending upon the results, then you further know that, do you need to really see a specialist, breast specialist or not? Or do you need to see a specific geneticist or not? This all can be very well answered by your next door gynecologist.
Okay. I'll give you that. I'll give you that. All right. So I think I'm down to my last question here. And if anyone has any questions, please comment in the comment box, and then we'll address them. But my last question is, in the UAE, where are, like, can you give some resources? Where are the support groups? Where are the clinics we should be looking at with specialists? Can you give us a roundup of some of those amazing places that you speak so highly of?
All right. One of the groups I came across is Breast Friends, not the best friends, the Breast Friends. They are a local UAE-based group comprising of doctors, patients, nurses who have the breast cancer, and the well-being of a person diagnosed with breast cancer. That is their interest at heart. So that is one place you can get support. There's similarly, there is another group called Breast Caravan, Pink Caravan. Sorry. So there is another group which is a local support group.
Oh, Pink
where
Caravan,
you can,
right? Yeah. Mm-hmm.
Yes. So where you can get support. There are certain centers, medical centers, which specialize in breast health for women. One such center is a Life Medical Center. They have their whole range of diagnostic instruments, imaging, doctors. They are all gathered around specifically women's health, and breast cancer being the heart of it. So these are some of the places I really trust, and I would want my patients, whoever need, to get in touch with. Yes.
Okay.
There,
All
there
right.
are,
So
there are
I'll collect these references from you, and we'll definitely share it with the community. If you're not on our email list, please sign up. We'll share it. We'll share it via email for you. So I think now let's take some questions, and then before we wind down the night, and I think there's one here right now I can read off. So how much does the food type? How much does the type of food we consume play a part in the cancer prevention and/or recovery? That's a good one, actually.
It's a very good one, actually, because we missed out on this as a risk factor. The kind of food you eat, the kind of lifestyle you have is also a big risk factor for developing the cancer. And once you have developed the breast cancer, it is an important factor in how well you cope with it and how well you are able to, not get a relapse of it. So yes, there are foods which are rich in antioxidants, berries, these are very healthy. Food which is rich in fat, in general, eat healthy, you will stay healthy. This is a basic norm. This is a basic principle that works with everything, literally with everything. High fat diet is associated with increased risk of breast cancer. Alcohol is associated with increased risk of breast cancer.
Oh,
Smoking.
doctor.
And yes, and honestly, there is not any certain amount that if you're drinking 10 glasses a week, then you are in a risk zone. If you're drinking one, probably you're okay. No, it's not like that.
Okay.
Any amount of alcohol increases your risk. Smoking, trust me, smoking is the worst habit a person can have, even worse than being an alcoholic, because there's not a single cell in the body that smoking doesn't affect. There's not a single cancer in the body that smoking doesn't cause. So smoking is, again, so eat healthy, eat more fruits, eat more veggies, eat less fat, and the chances, there are actually studies on this, which show that a person who's been diagnosed with breast cancer and been treated for it, and there's a group who's eating healthy food and doing the right thing, and there is a group who's back to their normal lifestyle, they tend to have the disease come back. The 5-year survival rate in them is actually less. So the food, what kind of food, what kind of lifestyle, losing weight. So even if in postmenopause, after menopause, if you lose weight, it is a very, very good preventive measure to prevent cancer. Even after diagnosis, if you're exercising, if you're losing weight, it reduces your risks to get a relapse. Yes. So it does play a big part in your road to recovery.
Okay. Do we have any more questions for Dr. Megha? This has been really informative, so thank you. I've learned a lot personally. So thank you for that.
I'm glad I could help.
If you don't have any more questions, then I think we can wind down here and let you go, because I think this is a perfect way to end the evening. And then we'll continue talking with the community after.
All
But
right.
your references, we will love to share with the group. So if you guys are not on our email list, make sure you sign up and you'll get all the references that Dr. Megha talked about today, along with the recap from today's session. So thank you again, Dr. Megha. You have been so informative, so helpful. It was like I
Thank
really truly loved this session, and for it being my first, like, I'm getting information on my first live with the community. To me, it's like I'm just getting hit from all angles with, like, so it was a really, really amazing
thank you.
session. I'm excited
Thank
about
you for being
this.
thank you for being so patient, and thank you for having me over.
Oh,
I'm glad I
absolutely.
could
Thank
help
you.
you.
Bless you.
Take care.
Take
Bye bye.
care.
Have a lovely evening. Bye.
Bye.
And bye bye
Awesome,
to
guys. Thank you,
all of
guys.
the viewers. Thank you for coming here. Bye.
Thank